Hello, INRICH. I'm happy to join you and follow David's excellent presentation on our Child of the North report by just spending a few minutes thinking about how we as a network can move forward and really commit to taking action to tackle child inequalities. There's a real danger that we all fall into the trap of lifestyle drift, starting to think about tackling health behaviours and individual lifestyle factors rather than the broader social determinants of health, because it's easier or because they feel like more tractable targets. And we need to recognise that we need to not do that, and that tackling poverty, tackling inequalities, those are the kinds of things we need to be doing as health professionals, as public health professionals, as academics, if we want to reduce child health inequalities. And in the UK, we've got a rather sort of sad history of saying the right things, but not actually taking the kinds of action that is needed. We've got a history of having produced reports on inequalities in child health, government commissioned reports, starting with the Black Report in 1980, going on to the Aitchison Report in 1992. We have the Marmot Review in 2010, and the Marmot Review 10 years on in 2020, all of them describing health inequalities, all of them calling for the same solutions, and yet instead we've only seen inequalities widen. And as David described to you, we've seen child poverty rise in the last decade, and all of the indicators going in the wrong direction. And we're yet again in the UK waiting for a new government report on what's going to be called health disparities this time, unfortunately. But probably it will be doing the same job, describing health inequalities and not really helping us understand what to do about them. So what we need to be doing is thinking how we work together, thinking about the different levels we work at, and trying to do our best to take action. And I wanted to just think about three examples at different levels. First is internationally. Many of us here in this meeting are probably aware of the International Society for Social Pediatrics and Child Health position papers. Here's one that came out in May 2020 in response to COVID-19. When we have a collective policy paper or briefing at an international level, we can all use it to then advocate within our own settings. So I think it is important that we continue to do that kind of thing. Nationally, in the UK, we've got the Royal College of Paediatrics and Child Health, which has just created a Wellbeing, Health and Action portal. And anybody can go onto that portal, help look and see how the social determinants of health can be tackled professionally and in partnership with others. So we've got a sort of national level organisation working to try and do things. But we need to act locally as well. I spent some time working with the Greater Manchester Independent Inequalities Commission. We came up with a model of interacting inequalities, recognising how demographic inequalities, things like age, sex, gender, race, ethnicity, interact with socioeconomic inequalities, whether that's in power and voice, whether it's in income, whether it's in access to care, and that these can vary geographically, but that those entrenched and intersecting inequalities interact to affect well-being and quality of life. And using that model, we were then able to come up with recommendations that the Mayor of Greater Manchester then put into his re-election manifesto. Some of those have been translated into actions in the new Greater Manchester strategy, and then we can see whether or not they're being implemented and hold the combined authority to account. And one of the actions that they've committed to taking is putting in place a new performance network framework, which for the first time will include what they're calling neighbourhood floor targets. And that is saying there's a minimum standard that we expect to be able to meet in different neighbourhoods. And the floor targets they're piloting are number of premises, the proportion of premises within a neighbourhood that are unable to have digital access. They're looking at the proportion of take-up of funded childcare and early education places for 2-year-olds, and the proportion of young people, actually that should be around 14 years, reporting good and higher well-being. So by having these local neighbourhood floor targets, they can monitor their own performance in reducing health inequalities within their region. So we need to be acting at all those different levels, internationally, nationally, local, wherever it is we think we can have the most traction. I'm going to leave you with some resources, links to where you can find a download for our Child of the North report, where you can find the final report of the Greater Manchester Independent Inequalities Commission, and a link to the Royal College of Paediatrics and Child Health portal. But I hope that as an organisation, as a network, we in INRICH can, by the end of this conference, be starting to think about concrete actions we might take. Can we produce important, actionable briefings through our network? Can we, within our own nations, act within our professional organisations to act for change? Can we, within our own localities, within our regions, within our cities, push for local policy that will help to tackle health inequalities? I hope we'll be able to do all of those, and that INRICH can be a real vehicle for promoting action at multiple levels to tackle child health inequalities. Thanks very much.